The if the screen's moved on, this is our basic nursing mattress. So some of the Brendoncare homes use this, and it's a simple profiling mattress. It's medium risk. It's got your wipe clean cover. It'll work on profiling beds. You can also have a shorter one which will fit on divan beds. The seams are stitched. You've got a zip all the way around so that you never have to worry about what's going on inside the mattress if there's any leaks or contamination, because you can inspect the inside. And then you've got a white backing on the inside of the mattress just to show you any stains straight away when you're doing your mattress audit. So we don't give clinical advice because I'm not a nurse, but what we can do is with your nursing and care knowledge, we can fit in with the product knowledge and our industry experience. So it's like that hopefully that works for everyone. Is that okay, Sean?
Yeah, thank you.
Yeah. And then we go to our most popular. This is the most popular mattress we sell, and there must be lots of them within Brendoncare. And that TPC comes from our original brand name, which is Total Pressure Care. And this is the most popular mattress we sell. It's a high-risk foam mattress, and it's got a welded seams cover, so it lasts a long time in the nursing care environment. All the seams are welded, which simply means that there's no stitch holes, and so welding is just a different process. And the crudest way to describe it is it's almost like a form of heat sealing. So wherever you normally would have a stitch line, and as we know, if there's fluids, whether they're bodily fluids or cleaning fluids, they're going to find their way through little holes in stitches eventually. And over time, you can get stains. So what we've done is we've got a welded seams mattress, and it literally seals wherever you need to join the fabric. It's very, very strong seam, which is absolutely impervious. So it's almost as if the mattress is made of one piece, and then you've got a covered zip which is all concealed so that the fluid drips away from it. And again, you can inspect the interior, and that's the one we provide the most of. And then we go on to the next one. The Flow Plus is our standard air mattress, and the way to identify it when you've opened the cover is you've got the foam base and the alternating air top. And the reason for having the foam base is to provide a lower height mattress. On some older nursing beds, the rails aren't as high as the new ones. So the latest spec nursing beds have got, the law has changed and the rails have to be much higher. But if you've got an old nursing bed that's say 10 or 15 years old and you put a big deep cell air mattress on it, you'll find the resident is very close to the top of the rails and they're not doing a lot. And so that's where this mattress was developed. They're 555 on the pounds, that is the price on the Brendoncare contract. They're high risk, and some of the old deep cell air mattresses could be anything up to 9 or even 10 inches deep, which is a really, really high mattress. So if you pop an old style mattress on a low bed, you're really then lifting the resident right up. So this is a way to get them a bit lower. And then we go on to the hybrid mattress. And so on the hybrid mattress, the best way to describe it is it looks and feels like a foam mattress. It's the lowest height air mattress that you can get. And so they're the same dimensions as a normal foam mattress. And what happens is on the image on the right of the screen is a cutaway image. And so what you can see is it's a foam mattress and the center section, there's a layer of air cells embedded deep within the foam. So what you've got a mattress which has got, it's not very clear on this left-hand picture, but hopefully where the little emerald coloured cursor is, you can see the indicator is pointing to high and very high. The reason for sort of lingering on this mattress is because it's quite versatile, and you can put the mattress itself in with no pump and use it just as a normal high-risk nursing mattress. If the resident, their condition changes and they then need alternating air therapy, you can actually just add the pump, and the within the cover there's some tubes which are hidden behind the zip. You can pull the tubes out, connect it up to a pump, and that resident, without swapping anything, has instantly got a very high-risk air mattress. And because the air cells are encased in the high-risk foam, you might find you have residents that are on palliative care, or they don't like air mattresses because of the hisses or the moving sensation when the cells swap over every 10 minutes. In a hybrid mattress, all that activity is a lot more muted. So the alternating action feels a lot softer. And if somebody's in a lot of pain, or they're very, very frail towards the end of their life, the hybrid mattress is a really comfortable solution, because all those traditional air mattress sensations are quite muted. The other thing with the one we now supply is it's got built-in evacuation, so hopefully it's a feature that none of our customers ever need to use. But if you do need to use it, every hybrid mattress has got the evacuation sheet built in to the bottom of the mattress, and there's some straps underneath which come, like you see on this top left here. They can be pulled out and obviously safely strap the resident. You've got handles at the end and the sides, so it's like an added bonus that you've got that evacuation sled built into each of those. So it's quite a it's really an all-in-one. It does three things. It's a high-risk foam, it's a very high-risk air, and it's also an evacuation device. Sorry, and the fourth point is it's really low, so it's no thicker than a foam mattress. So yeah, I've gone on about that one quite at length, but it's got a lot going for it. And then we move on to the traditional very high risk air mattress. And as you can see, this is the full height air mattress. This is what we call Flow Max, and this is where the nurse would recommend that the patient needs a very high risk traditional air mattress. So when I say traditional, it's 3 layers of cells. You've got, on this diagram here, you can see you've got a single layer of base cells, air cells, which stay inflated all the time. You've got 3 double height pillow cells, which obviously stop the resident's pillow moving during the night. And then the rest of the mattress is made up of double height alternating cells. So they just simply swap between one another. They inflate, they deflate every 10 minutes. And you've got a remote control with this. The main reason for using a remote control is it's got a sitting function on the mattress. So when you lift the backrest of the bed up to maybe eat a meal or watch television, a lot more of your weight is going to go down through your backside. So on a basic air mattress, sometimes those cells that you're sitting on bottom out, which can be uncomfortable. So when you put this mattress into the seated function, the 3 cells that are under your bottom, they inflate a little bit harder. So as you sit up and eat your meal, you're better supported. And what happens is if you forget to switch those cells off and the resident goes back to sleep, they lie down flat, they will always go back to alternating after a certain time, just to protect the resident from having cells that are too hard under their bottom, for instance, at night. And that particular air mattress, and I should have put it on the hybrid page, but the the Flow Max and the Hybrid are both available in extra wide versions. So if you have a particularly large resident that needs a bigger bed, instead of using the 90 centimetre wide version, which is your normal nursing care width, you can have it in a 120 centimetre, so it's 4 foot wide basically instead of 3 foot. And this auto pressure sensing, it just simply means that the once you've set the resident's weight band, so let's say the wet resident is 90 kilos, it'll monitor that weight all the time, and if anything changes, for instance, if the wet resident lost a little bit of weight or put a little bit of weight on, the mattress will actually detect that change in weight, and it'll soften it slightly or harden the mattress slightly if it's extra weight. It'll do that automatically.
So the nurse doesn't have to set it, you just turn it on.
Initial weight bands, which you would set,
Oh.
but then the weight, the fine tuning of the mattress day to day, the mattress takes care of that itself. If the resident lay in a funny position, for instance, let's say they had contractures and their knees are curled round, it will also take account of that. So it takes feedback from the pressure that the resident puts through the cells and just continuously monitors it and just gradually adjusts the mattress. Yeah, that's what we've got now is just a simple table. So you've got, by static mattress, we simply mean it doesn't move. It's a foam mattress. Active it's an air mattress. It alternates. Obviously, the risk category speaks for itself. And then the price point. And then we've got your two foam mattresses. Obviously, they're static. We've got a medium and a high, and your price. Your Flow Plus, which is the standard air mattress, is active, high risk. That's the price. And then your Flow Hybrid, as we went through earlier, it can be a static or an active, and a very high mattress, very high risk. And then you've got your Flow Max, which is your very high risk active mattress.